Welcome to The Explainer. We're all about taking these really complex, sometimes intimidating topics and turning them into visual stories that just make sense.
So, what if a routine surgery, something thousands of people have every day, suddenly became a life-threatening challenge? And what if that all happened before the first cut was even made? Well, today we're diving into exactly that. It's the case of a 45-year-old woman whose rare disease turned a common procedure into a really high-stakes puzzle for her entire medical team.
All right, first up, let's meet our patient and really get to the heart of the puzzle her doctors were facing. Okay, so at first glance, this looks pretty straightforward, right? We've got a 45-year-old woman, and she's scheduled for a laparoscopic cholecystectomy, which is just the standard, minimally invasive way to remove a gallbladder. But here's the twist. She has a coexisting disease called dermatomyositis, and this condition comes with some really serious symptoms, like muscle weakness and dysphagia. That's a technical term for difficulty swallowing. And that one piece of the puzzle, well, it changes everything.
So, what exactly is dermatomyositis? Well, it's not just a skin and muscle issue. Think of it more like this. It's a systemic autoimmune disease. That means the body's own immune system gets confused and starts attacking itself. This attack causes chronic inflammation that damages not just the muscles and skin you can see, but also vital internal systems. For an anesthesiologist, this turns the patient's body into a potential minefield of hidden dangers.
So what were these dangers? What made anesthesia so incredibly risky for her? It wasn't just one thing. The medical team had to navigate 4 major challenges all at the same time.
And this is where it gets really complicated. Each one of these is a huge deal on its own. First, her lungs were fragile and stiff from interstitial lung disease. Second, that swallowing difficulty meant a high risk of aspiration. That's when stomach contents get into those already fragile lungs. It's a nightmare scenario. Third, her muscles were totally unpredictable. The standard drugs used for surgery could have a bizarre, prolonged effect. And finally, because she was on long-term steroids, her body couldn't produce its own stress hormones, the very hormones you desperately need to get through a surgery. It's not one problem. It's a complex web where each issue makes the others even worse.
And these numbers, they really put that lung damage into perspective. Her forced vital capacity, basically how much air she can breathe out forcefully, was only 65% of what it should be. And her gas transfer, how well oxygen actually gets into her blood, was even worse, down at 60%. For an anesthesiologist, seeing these numbers is like a giant flashing red light. It means putting her on a standard ventilator could literally injure her lung. So how do you solve a puzzle this complicated? You can't just use the standard playbook. No way. The team had to become architects. They had to design a completely custom, bespoke anesthesia blueprint from the ground up, built entirely around her specific set of risks.
And just look at the difference here. Instead of the usual anesthetic gases that can affect muscles, they went with total intravenous anesthesia, or TIVA, for much more precise control. They didn't use a standard dose of muscle relaxant. They used a tiny, carefully measured dose and watched it like a hawk with advanced monitoring. To counter that aspiration risk, they used a specialized, super-fast intubation technique. And to help her body cope, they gave her stress-dose steroids right up front. Every single choice was a strategic countermove to a specific threat.
So here's what that blueprint looked like in action. A clear 4-step protocol designed for safety. Step 1, preparation to minimize that aspiration risk. Step 2, a rapid controlled induction using TIVA to secure her airway instantly. Step 3, maintenance, constantly tracking her muscle response in real time. And finally, step 4, reversal, using a modern drug called sugamatics to ensure she was fully strong and breathing on her own before the breathing tube came out. Just a beautiful, logical sequence.
Okay, so the plan is meticulously designed. Now it's game time. The team puts their strategy into action, and every single second is about execution, monitoring, and adapting.
And the plan just unfolded perfectly. The critical first 5 minutes, successful intubation, airway secured. Done.
For the next hour, they managed her lung pressures and kept her vitals remarkably stable. And then, at the 75-minute mark, the reversal agent goes in. Just 10 to 15 minutes later, she's breathing on her own and the tube comes out. A textbook execution of a very non-textbook plan.
Now this number right here, this is absolutely crucial. 18 centimeters of water. That was the maximum pressure they allowed in her lungs. Keeping it below that critical threshold wasn't just a goal, it was proof. It was the measurable evidence that their protective strategy had worked, and they had kept her fragile lungs safe.
And here's the other magic number, the one that gave them the all clear to wake her up. That train of 4 ratio, you want it to be 0.9 or higher. Hitting that number isn't a guess. It's objective, hard data that tells you the patient's muscles have fully recovered and that they're strong enough to breathe safely on their own. It was the green light they were waiting for.
So, the surgery was a success. But the story doesn't end there. Because what we can learn from this single patient's journey reveals so much about how to manage any complex medical case.
You know, this quote from the actual case report really says it all. It points to a combination of things: preparation, that special muscle monitoring, using TIVA, and the steroids. The big takeaway here is that success wasn't about one single trick or a magic bullet. It was about the synergy, the way all these carefully chosen strategies work together to create a safety net.
So, what's the bottom line here? First, a really thorough preoperative assessment is completely non-negotiable. You have to know what you're up against. Second, a customized plan is always going to be a one-size-fits-all approach. Third, that advanced monitoring provides the critical, real-time data you need to make smart decisions. And finally, none of this works without teamwork. That collaboration is the absolute bedrock of patient safety.
And this all leaves us with a really interesting thought. This incredible level of planning, this intricate dance between science and strategy, it happens every single day in operating rooms around the world. It makes you wonder, right? What other routine parts of our world are actually masterpieces of hidden complexity, held up by an incredible depth of expertise and planning we never even see?